So we're going to take a look at the ODU Explorer. It has a very thin shank. It's designed this way so that we can feel small vibrations as we use this instrument on the tooth to help us find deposits or to help us find irregularities in the tooth structure. So we want to keep this, we're going to use the lateral sides as we activate this. We don't want to use it so it's on the tip. We want to always use the lateral side. We want this instrument to be used so that it's always parallel. The terminal shank, which is just this very lowest portion right here, should always look parallel with the long axis of the tooth. So the first thing we always do is make sure that we're using the correct end. So we're going to place this instrument for the anterior teeth. We'll place it between the central and the lateral, and we're going to put the point between these two teeth and take a look to see if the terminal shank, which is this portion right here, looks parallel with the long axis of these teeth. And it does. But we can't stop there. We have to also take a look at this instrument when we place it on the mesial line angle closest to our fulcrum hand. If we have the correct end, it's going to be curved towards the tooth. And in this situation, it is curved towards the tooth. So this is the correct end to use for all of these facials, all of the surfaces toward and away, if we sit at 12 o'clock. If we have the wrong end, then as we place this between the lateral and the central, you can see it looks a little bit wrappy. But sometimes we can kind of fool ourselves. If we stand up on our fulcrum, it doesn't look too bad. However, our wrist doesn't look good. If we lift this out and we place this on the line angle closest to our fulcrum hand, we can see that the instrument is curved away from the tooth. So if we were to use this instrument subgingially, and it being curved away from the tooth, we would cause significant tissue trauma. So this is the wrong end. So we're going to place this instrument on the correct end, and basically we're going to start at the distal line angle, and we're going to have that terminal shank rather close to the tooth. We're not going to lift it up high like that. We're going to have that terminal shank very close to the tooth. And we're going to start at the line angle, and we're going to make very light, floating type of exploratory strokes. We're as light as we can be. If you try to lift this out of my hand, you could definitely do it because I'm very light in my grasp. Notice my grasp is a modified pin grasp. I have my middle finger here on this shank, and that is to help me feel the deposit. So this is my feely finger, and I have my index finger and my thumb right at this intersection of the shank and the handle. And by holding it in this way, I'm able to roll this instrument and turn it in as I need to as I work my way around the tooth. So as I do this distal area here of this tooth, I definitely need to keep rolling this instrument with my index finger and thumb so that I'm staying parallel. And I want to continue to do that. So again, this instrument should look parallel, but I got to tell you, I think the very best way to use this instrument is just to continue to tuck it in and roll it just a bit. So it isn't perfect parallel with the long axis. It might be just slightly huggy to a perfect parallel. So once I have finished exploring this and rolling to tuck it in, I'm going to lift up and I'm going to go back to that line angle away from my fulcrum hand, and I'm going to make small little light exploratory strokes. The exploratory stroke is light inserting and light coming out. So we insert, we go all the way to the base of the pocket, and we make these light little flowing exploratory strokes. Once we get to the line angle, we must roll it a lot to make sure it's tucked in. If we don't, we will cause tissue trauma. One of the things students do often when they're learning this is just continue on like that, and you can see that that terminal shank is not parallel with the long axis. So once we get about to this area, the student needs to start standing up on their fulcrum and rolling up a lot, right here. If they wait too long, they're going to cause tissue trauma. So we roll, 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 roll right here. And you can see that this is parallel with long axis, but maybe just a little bit slight huggy to being perfect parallel. That would be the ideal.